Hi, my name is Dr. Taylor Van Weinboom. I'm here with Nova Integrated Health, and we're located in Ankeny, Iowa. You can reach us at facebook.com/Nova Integrated or at our website, novaih.com. So a little bit of background. I am actually a chiropractic physician, so we're going to be talking about regenerative medicine, and when we look at that, I own the clinic, I operate the clinic, but I'm not the one who's giving the injections. The way that we kind of shifted into the Nova aspect of our clinical practice was, my background is doing functional medicine, clinical nutrigenomics, emotional recalibrations through different techniques, all working with chronic issues to get people healthy. Well, it was a natural progression when regenerative medicine really started to get a lot of attention, and seeing what was happening with it and the results that it could get, is that it needed to be added into my practice because it gets results and things that I couldn't get before. And we're here to help people, and this literally is the biggest medical breakthrough in our lifetime. So it had to be part of my clinic, and the natural progression for that was to open Nova Integrated Health with more of a focus on those chronic issues and the regenerative medicine aspect of that. So we'll go into that a little bit more as we go on through here. So why are we talking about that? Well, basically because drugs don't work. If the drugs worked, we wouldn't be having this conversation right now. The problem with the drugs is they do nothing to address the underlying problem, which is the regeneration of damaged and degenerated tissue. So we're going to kind of focus more on the joint aspect of things today. We're going to hit on a couple of the more chronic issues that we deal with as well, but I'll be making different videos dealing with those specific chronic issues individually. But we'll hit on them a little bit tonight as well. So VIOXX. In a plea agreement with federal court, Merck will pay $950 million for the legal promotion of VIOXX for the treatment of arthritis. So if we're talking about degenerated joints and you've had it for long enough, you know what VIOXX is. It was on the market, it was a big drug. Well, VIOXX caused the death of over 60,000 people. And that's just the people that they can actually confirm the death was from VIOXX. So it was withdrawn from the market in 2004 when it became apparent that it was causing heart attacks. So I add that in here as one, to show the drug aspect of things that we're talking about, but two, VIOXX was FDA cleared. VIOXX was on the market. VIOXX had passed all the things leading up to a drug being available to consumers, and it was still super detrimental and killing people. So I compare that in here, and we talk about regenerative medicine, we talk about stem cells specifically, as people always want to say, well, there's not enough research on it, there's not enough this, that, or the other, it's not FDA cleared. Well, it's not a drug. So this was FDA cleared, this was on the market, this was prescribed to hundreds of thousands of people, okay? And it was killing people. Corticosteroids, another instance of where the drugs don't work. So a corticosteroid, if you have degenerated joints, you've most likely had a cortisone injection. That would be a corticosteroid. So what a cortisone injection does is, it helps decrease inflammation. It's typically an anti-inflammatory, right? Well, there's a lot of inflammation with degenerated joints. The thing that they don't tell you in respect to these corticosteroids is that they actually increase cartilage cell death. So cartilage would be things like your meniscus, the actual stuff that's supposed to keep your joints from being bone on bone, right? Well, a lot of people have pain because of the degenerated joints. So they go in for a cortisone injection, and what they don't tell you is that that cortisone injection that they're giving you is catabolic, which means that it breaks down, and it actually is killing the cartilage within your joint. Well, that seems counterproductive, right? Yeah, it is. And also alters cartilage and collagen production. And the problem with both of these aspects is it doesn't just happen in the localized joint that you get the injection in. So say I have a bad right knee, and I go in for an injection in my right knee to help it feel better, at least temporarily, because typically these things you have to get 3 or more times a year. Well, I get that, and what happens is this goes systemic. The cortisone doesn't just stay in my knee, and it does these same things in my other joints. So we have a lot of people that come into our office and say, well, started in my right knee, a couple years later, got it in my other knee, now my shoulder's going bad. Well, why do you think you're having this progression of bad joints? Could have you lived a really hard lifestyle? Yeah, absolutely. But a lot of it has to do with this cortisone injections. If you talk to an orthopedic surgeon, typically what they're going to tell you is that a person should only get 3 cortisone injections for their entire life. And the reason for that is they know that these things are going on. They know that there's a cartilage cell death. They know that it alters the production of actually making those cartilage back into the joint as well. And they see the repercussions of that all the time in their practices. Now, if you go to your general practitioner, they'll say, hey, you can get 3 to 4 injections per joint per year. So you get 2 bad knees and a bad shoulder, that's at least 9 injections for a year. Well, you can imagine what that does cumulative wise and how bad that is for other joints in your body as well. When you're looking at cortisone, it also decreases immunity, so another bad side effect. It's also toxic to stem cells. So if somebody were to come to our office and want to get some kind of a regenerative medicine injection, we'd say you have to wait at least 30 days before or 30 days after a cortisone injection, because it will literally kill the stem cells, which would be very counterproductive and a waste. It also decreases the ability for repair of tendons. Now what they've done is they've actually seen that the progression of the degeneration in the joints is regardless of treatment. So what they did is they did studies. Group A and B both had degenerated joints. Group A got cortisone injections. Group B got placebo injections. What they found is Group A over time would have more degeneration in their joints than Group B. Well, that makes sense if we look at that it actually increases cartilage cell death, and it alters the cartilage and collagen production. So once it kills those cells, it also alters the ability to replenish those cells. So it makes sense when you look at it. So you really have to think when you get these things, what's it doing over the lifetime, not just the short-term, effect of helping decrease the inflammation. Because what we want to do is regenerate those tissues to naturally decrease pain and function, increase function. So there's 3 main types of therapies that we use in our regenerative medicine, at least currently. I'm sure we'll add more later. But we're looking at Dextro-Therapy, Prolozone, and regenerative cell therapy. Now, the reason we're going to go over some of these other ones is because maybe you're a better candidate for some of these other things. Maybe, cell therapy isn't the best thing for you. And that's why we have to have you come in and check you out and do, some, maybe lab work or whatever, depending on what the case is. More chronic stuff, obviously you're looking more that route. But a degenerated joint, if it's not that much degeneration, after we take the x-ray and examine it, maybe one of these other therapies is going to work better for you. So Dextro-Therapy is used on multiple issues. You're looking at joint pain, tinnitus, Morton's neuromas, nerve pain, diabetic, and just in general neuropathy pain, trigeminal neuralgia, lipomas, painful scars. So what Dextro-Therapy does is it actually releases the nerve from entrapments. So what happens is the nerve should kind of glide. So when I move my arm like this, that nerve should glide. It shouldn't catch through there. What can happen is if you get some of these scar tissues or adhesions, it'll actually bind that nerve in there and you get this stretch and this constant aggravation. Well, the Dextro-Therapy will actually relieve that. It'll actually free that nerve up so that it can move like it's supposed to, help decrease the pain that way. Prolozone, typically used for more joint regeneration issues, and obviously pain relief is part of that as well. So it's a mixture of procaine, B12, sodium bicarbonate, and ozone. And Prolozone, when you look at it, really the joints and their correlating tissues are very avascular. So what we're looking at is really increasing that oxygenation to the joints to help them heal. So as we get older, circulation decreases. Everybody knows that. Your hands are a little colder, your feet are a little colder, your nose, your ears, the peripheral areas of your body. And you couple that with trauma, well, like say edema, inflammation, further decrease in oxygen, increase in lactic acid, free radicals, all these other things that just make it worse over time. It's almost like your joints are set up to fail over time. But we can help with that. So ligaments, this is just like a for instance, so ligaments and joints have decreased oxygen tension. So in a healthy individual, a ligament has only 1/10 the oxygen tension of tissues even just millimeters away. So we're talking about that oxygen, we're talking about that ability to heal. So if we can do the Prolozone, it'll restore oxygen utilization and areas of chronic pain will become normal again and chronic degeneration begins to regenerate. So this x-ray was actually from the Journal of Prolotherapy, and here's a pre-x-ray and a post-x-ray after multiple injections of Prolozone. So you can see increasing that oxygenation has regrown that meniscus tissue in that knee, which obviously is going to help decrease pain, increase functionality, and obviously the lifespan of that joint. Looking here, most of those orthopedic surgeons are going to say that joint needs to be replaced. There's nothing that can be done. It's going to continue to get worse, and there's nothing you can get besides maybe some cortisone injection. Well, imagine for a second if you could regenerate that tissue. That's a pretty good deal, right? So conditions for Prolozone, you're looking at degenerative and arthritic joints, obviously knees, wrists, hips, ankles, feet, shoulders. If the joint is degenerated, it would help with that. Degenerated discs, chronic neck and back pain, heel spurs, painful scars, rotator cuff injuries, tennis elbow, TMJ, carpal tunnel, neuromas, plantar fasciitis, and sports injuries. So regenerative cell therapy, this is what everybody wants to hear about. This is kind of the big buzzword, right? And like I said before, it's definitely one of the biggest medical breakthroughs in natural healing. And I'd say in our lifetime. I don't think we'll see anything that can match, or even come close to what these things are capable of. And it's the most cutting edge and revolutionary therapies available. You're talking about the actual research and getting numbers. I want to add these in here just so you can go look for yourself. You don't have to take my word for the things that I'm saying. I want you to go out, research, see if what I'm saying is true, because you should never believe anybody that just comes up and says, well, you shouldn't do this. You shouldn't do that. A lot of times people are talking out of opinions, not out of fact. And that's what typically happens when I talk to people about, potentially maybe some cell therapy, Prolozone, whatever, regenerative medicine for the joints, or maybe a chronic issue. And they'll say, well, I just don't think that it's, efficable. I don't think there's enough studies, blah, blah, blah. That's an opinion. Everybody's got an opinion. And you shouldn't just take that for fact, right? So go to stem cell research and therapy on Google. Type that in. You're going to go to their homepage. They have thousands of studies on stem cell therapy in different kinds of conditions. If you go to PubMed, the site contains all the case studies and medical breakthrough information. So when I did the search a little while ago, it wasn't tonight by any means, there were 7,400 pages of 20 different studies on each page. So you're looking about 150,000 studies on stem cell therapy. So like say, that's not just stem cell therapy for degenerated joints or stem cell therapy for MS, that's just stem cell therapy in general. But if you typed in stem cell therapy and whatever condition you want to look at, they'll come up with a bunch of hits on that too. So what I'm saying is there is a ton of research on stem cell therapy. So anybody who says otherwise, just go look for it. It's out there. And there's lots of stuff. I mean, I could say, looking at statins, there's a ton of research that says statins don't do anything, yet they're prescribed every single day for reasons that they shouldn't be, in my opinion, but all the research is out there to back up that specific opinion that I have. So do some research, figure it out. Don't just take anybody's word as God-given. So major medical centers. So we're based in Iowa. So these are the Midwest medical centers that are really well known in the area. Now Mayo Clinic obviously is well known in the world, but the University of Iowa is giving stem cell treatments after chemotherapy and radiation. Well, that's fantastic. I mean, it makes sense. Chemotherapy and radiation kills cells. It kills everything, right? So if we can regenerate some of those tissues post-cancer, that's a fantastic thing. That's a very great. The Mayo Clinic is using stem cell therapy to treat their patients. You go to their website, type it in. They have a whole regenerative medicine wing just recently too. So I say all this once again is, if you go to your general practitioner and they say, well, this, that, or the other. Well, if the Mecca of medicine, Mayo Clinic, is using stem cell therapy and they think that they know better than them, well, then maybe they should go up there and have a conversation with them and enlighten them on their opinion, okay? There's a ton of information out there. So some stem cell facts. We don't use embryonic tissue. Nobody does. Not in America, at least, because it is illegal. Now, even if it wasn't illegal, we still would not use embryonic tissue. Embryonic tissue is where stem cell gets a bad name, because that's where they take the sperm and the egg that have come together, and that's the embryo at that point, and they take the cells from there. That's not what we use at all. Not even able to. And like I say, we wouldn't. Stem cells do not cure or treat anything. And you say, well, why am I watching this? Well, because legally, to cure or treat anything, it has to be a drug. Stem cells aren't drugs, okay? They're not a cure-all, so they're not going to fix your foot fungus. They're not going to fix, mercury in your body from a bad amalgam. There's a lot of things that stem cells won't do, but there's a ton of stuff that stem cells will do. Stem cells therapy supports the body to allow for maximum healing. We'll touch on that more, because that's really the best thing that does, and the most interesting thing as far as stem cells specifically go. And it provides the body with the building blocks to heal. And they do the one thing that the medicines don't do, and that's help support degenerated tissues back to how they're meant to be, healthy. And that's what we need. So how do stem cells work? Well, this is obviously a shorter version of the full picture, but so you can get the gist of it. Basically, damaged tissue gives off inflammation, and inflamed tissues give off enzymes, and stem cells are attracted to these enzymes. So wherever there's inflammation, the stem cells are going to go. So you'll hear people that say that, well, stem cells, you have to use the fluoroscopy and you have to use all these different things to make sure you get them right where you need to have them. No, not even close. Check the research. They give stem cell therapy in IVs, and they'll still find the stem cells where they're supposed to be for the damaged tissue. Okay, so to say that they have to give them in this laser focused area is not true. Now, what's really interesting is I'm so worried about these stem cells getting out and going to other places. So like say you had, a bad knee and we want to give some stem cell into the knee to help regenerate those cartilage tissues, but you also had like a bad shoulder or a bad back, or maybe something more insidious going on. We actually give multiple shots, one into the joint specifically and one into an area called the brown fat. We'll hit on that a little bit later, but the reason we do that is I want all those cells that we just injected into your joint to stay there, because I'm so afraid that they'll actually leave because they're so attracted to inflammation and trying to heal those tissues. Now, another thing that they do that's really cool is the paracrine signaling, and this is where they actually signal your own stem cells to activate, to work, to regenerate, and do all these things. And the thing about stem cells is they do 4 main category of things. They control inflammation, so they're anti-inflammatory. They reduce scarring, so they're anti-fibrotic. A lot of times what you'll see is somebody who gets a stem cell injection, typically scars that they have on their body, maybe even from childhood, will either lighten or maybe even go away completely. They modulate the immune system, so they're immunomodulatory, so we use them for autoimmune issues. And they become other cells, and they stimulate regeneration. So for instance, like say, we're talking about joints, but if we're gonna look at something like multiple sclerosis, you can see how this could be applicable for somebody with a disease like this. So in the schematic, you have the different areas of the body that can be affected by MS. So brain tissue, visual, spinal cord, mouth, your sense, digestive system, muscles, and urinary system. So what this is a healthy neuron. So you have this neuron here, and you have all these Schwann cells that make up the myelin sheath of the nerve. And what happens is these are conductive. So, if I touch my hand here, that signal jumps all the way up through here to my brain. And when it does that is basically if I touched here, and then it goes to my brain through here. Well, what happens is this myelin sheath is like the wiring in a house. If I were to cut or take off these Schwann cells to break the connection in the myelin sheath, this electrical signal can't jump these cells. So what happens is these cells start to degenerate, because that's what MS does, is it attacks your Schwann cells so that they're not healthy and they're not making the connections like they're supposed to. And what happens is these signals can't jump like they're supposed to through this system to activate your body, whether that's like say your senses, your motor, your speech. So you see in this diagram they're showing exposed fiber through here, the signals, it's blotchy through here. So medications for MS, what they're trying to do, they're trying to ramp up some of these signals so that they can get the signal so strong that it can jump some of these areas that are having issue. What we would really like to have happen, obviously, and when we're looking at regenerative medicine, is if we could get these cells to potentially regenerate. If we can regenerate them back to here, what do you think will happen to symptoms? What do you think will happen to a person's life if you can fix these issues back through here? So they've done studies on people with umbilical cord mesenchymal stem cells. And what they've done, they've injected them, because what happens is usually you have these T cells, excuse me, that are attacking the myelin sheath, and they're usually modulated by the T regulatory cells. So what they've found is these stem cells will actually bring these T regulatory cells and these T cells back into equilibrium, because they're dysregulated in this situation. They're regulated in this situation. So what they found is that the stem cells will actually re-regulate that imbalance of those T cells attacking the myelin sheath for people with multiple sclerosis. So really cool cutting edge things that we can deal with. We can walk with people. Now with that, we'd want to look at some other things besides just filling somebody up with a bunch of cells and sending them out the door. We want to really figure out what's going on with these things too. But like say, just talking about those other things, and you can see how that works in relation to the joints as well, as far as regenerating those tissues. So types of stem cells, and really there's 3 main types as far as that we look at. You have your umbilical cord, your adipose, and your bone marrow. So umbilical cord is an allograft, an adipose is an autograft, and the bone marrow is an autograft. Autograft means from you. Allograft means from somebody else. So the umbilical cord cells are live birth C-sections. So mom's okay, baby's okay. What they do is they take the afterbirth and the stuff that they usually would throw away, they harvest the cells from there because it's rich in stem cells. And they test mom and baby before, or mom beforehand and mom and baby afterwards, just to make sure there's nothing going on. Make sure that there's no possible infections or anything that might be affecting the cells as far as that goes. Adipose is from fat tissue, so it's a small liposuction procedure where they go in, pull the fat, spin it down into stem cells, and re-inject those. Bone marrow aspirate is you're going to go into the hip, typically the iliac crest. You're going to pull out bone marrow. So they go with a needle, basically, stick it into the bone, pull out the bone marrow, spin it down, and then they re-inject those stem cells into a person. So for us, typically we like to go with umbilical allograft, and I'll tell you exactly why. The robustness, so these cells are brand new, okay? And they are considered adult stem cells because they're not embryonic stem cells. So they're adult stem cells, they're brand new cells, they're immunoprivileged, so there's no markers on them, so your body doesn't recognize them as foreign, but they have a higher rate at which the cells multiply or double, and higher amount of trophic factors. So they multiply more. The thing about stem cells is you're born with a certain amount of stem cells, and as you age, those stem cells age as well. So let's look at like a woman with her ovaries. So a woman's born with a certain amount of eggs. Now as she ages, let's say hits about 40, you'll hear a lot of practitioners say, well, you know, maybe you should think about having kids past 40 because the chances of genetic issues, something like a Down syndrome, go up dramatically because those cells have aged. So now older cells are more likely to have defects and not work like they're supposed to. So with an autograft, let's say we take them from a 67-year-old. Well, those stem cells are 67 years old. So they're not as abundant as they used to be, because they get used as you get older too and have injuries and have issues. But they're just not as robust. They're not as good as a young cell. I mean, if you took a 20-year-old versus an 80-year-old in surgery, who do you think a surgeon's gonna wanna work on? The 20-year-old. They bounce back better, they heal faster, there's better outcomes. So we like the robustness, we like the young cells. Like I say, they're still adult cells, they do a great job. Autologous stem cells contain more nexins, cell death markers, reactive oxygen species, free radicals, more interleukin 6, which has also increased the inflammatory response. So just other reasons why we prefer more of the allograft as opposed to autograft. Now, if somebody really came in and wanted to do an autograft, you know, adipose-wise, we don't do the bone marrow. You know, we could do something like that. Most people that you talk to, most clinics will say, well, they do autografts, and if you want, we'll do an allograft. Or the complete opposite. These cells are so robust that they will just work better, in my opinion. And if you look at the research, it's all out there that, well, most people are kind of going towards that umbilical cord mesenchymal stem cell. So just like, say, a good example would be a 2-year-old breaks his arm. How long does it take to heal? About 2 to 4 weeks. A 15-year-old breaks his arm, takes about 4 to 6 weeks. And a 6-year-old breaks their arm, takes about 8 to 10 weeks. So like I say, as you get older, just things don't work like they used to. And I don't have to tell you that. I'm sure you know that. I know that already. Things aren't like they used to be. It takes a lot longer to recover. It's just a fact of life. Conditions for umbilical cord allograft, obviously degenerative joints like we're talking about, knees, hips, shoulders, neck, low back, whatever you're looking at through there. Peripheral neuropathy, neurological disorders like we talked about with the MS, the Parkinson's, stroke rehab, ALS, really any kind of disease that has a degenerative quality that needs to be regenerated. Okay, that's what you'll see as a common factor in all these things that we're talking about. So even like the MS is typically, like say, looked at as an autoimmune issue because your body's attacking your myelin sheath. Well, like say, the stem cells are also immunomodulatory as far as regenerative. An autoimmune disorder, so you're looking at Hashimoto's, Crohn's, lupus, RA, these are all autoimmune issues. So I mean, obviously, think of any kind of autoimmune issue that could fall in that category. Fibromyalgia, chronic fatigue syndrome, adrenal fatigue. Conditions like COPD, emphysema, pulmonary fibrosis. Now, how does that work? Well, you can actually nebulize the cells to breathe them into the lungs to help heal the lungs. Heart disease, Lyme disease, diabetes. So how long will allograft injection last? Cells will repair and regenerate tissue in patients will show improvement for a period of up to 12 months. Now, when I say that, people always get confused. So I'm trying to make it as clear as possible. So the cells, when they're injected from day 1, will regenerate and help tissues heal. They will continue to do that for up to a period of 12 months. So it doesn't take 12 months for the cells to start to heal. It doesn't take 12 months for your knee or hip or joint to feel better, but they will be in your system and they will continue to do what they do for a period of up to 12 months. And the typical response is seeing a reduced pain and regeneration of tissue, exactly what we want to see with that. Typical side effects with the injection is no different than any other injection. You know, maybe redness, swelling, you might need a Band-Aid. And how do we know which protocol to use? So we always tell people, we encourage people to bring blood work in, bring your lab work in, so we can look at that just to see what we're dealing with and what might be some complicating factors as well. Case history, so there'll be some paperwork that we want to look at just to see everything that we're dealing with as well, in those aspects as well. X-rays, so we do X-rays on our orthopedic cases. If you're looking at degenerative joints, we want to take an X-ray to see what we're dealing with, and we also want to take a post X-ray 3 to 6 months down the road so we can actually show you the regeneration of tissue. So we can show you from measurement from day 1 to measurement from, you know, 90 days out, 120 days out, whatever it is, to show you visually fact that you are better and that that joint has regenerated. And it's really cool and it's really rewarding to see those things. In orthopedic, like I say, we're looking at the 2 injections. One injection into the joint and the other injection into the brown fat. Like I say, the reason we do that is because I am so worried about the stem cells leaving the joint that we're trying to heal that we give another injection to an area called the brown fat. The brown fat is typically right underneath the scapula, the blade of the scapula, or the angle of the scapula, excuse me. There's also a little bit up here by the clavicle and a couple of different areas, but what the brown fat is the highest concentration of mitochondria in the system. Mitochondria are the powerhouse of cells. So they replicate faster, they do better there. And if you have a chronic issue, like say the MS or neuropathy, Parkinson's, whatever it might be, typically the injections will be in the brown fat itself to go more systemic. So we want to give an injection to the joint specifically, and we also want to give an injection to the brown fat so that those cells stay exactly where we want them to be, and if there's other stuff going on in the system, they can go there and help to regenerate those tissues and everything that we want in that specific joint. The reason that you might come into the office, stay there. Now, like say if you have a chronic condition, it'll be a series of injections into the brown fat only. What's nice about this is we can have patients from any state. So if you're watching this and you're not from Iowa, it's not a problem. If you come into our office, it's typically 2 to 3 appointments. If you've watched this, it's only 2 appointments. One is the consultation to make sure that you're a candidate, make sure that you're actually somebody that we should be doing this with, that you fit all the bill as far as a healthy, good candidate, and then the actual injection itself. Now, chronic conditions is a little bit more. It's a little bit more extensive, and we might do more blood work and a possibility of therapies that go into that as well, because it's a little bit more complicated if somebody comes in. And I just use MS as an example, but if somebody comes in with MS, we don't want to just load you up with a bunch of cells and send you out the door. We want to figure out, you know, what might have been some causative factors. What can we get rid of, you know, maybe dietary wise? What can we get rid of if there's maybe some heavy metal toxicities that'll help your body heal faster, but also keep things from coming back, or keep the regeneration that we've accomplished where it's at, and not to, you know, go and degenerate again once you've left the door. We want to get you as well as possible and get you out of the door and not see you again for the exact same thing. Okay, now if you came in for something else, you came in with MS and then all of a sudden you had a bad knee, that'd be fine. But we don't want to see you back in our office once we've gotten you to a good point. So cost, everybody wants to know cost. So if you're looking at the Dextro-Therapy, you're looking at $150 to $750. Now there's a range there because typically the Dextro-Therapy is multiple injections. Usually it's, well, I just say usually, almost never is it going to be just one round that you're going to see any major results from. It's congruent therapy, so you're looking at multiple rounds to get a good effect as far as that goes. Same thing with the Prolozone. Typically you're going to look at multiple injections, and that's $250 per injection. So like say if somebody had degeneration in the joint, that's going to be typically, you know, 7 to 8 injections of the Prolozone to get good results. Now you're looking at stem cells, so the average cost across America, you're looking at close to $10,000, and that's per treatment. But some clinics have reduced their cost to as little as $7,000 according to ipscell.com. And while it may seem cheaper to go outside the United States, that's usually not the case. It can cost from $20,000 to $100,000. And I actually have a colleague who practiced up in Wisconsin. I saw a couple patients last week. One paid $60,000 for 2 injections. The other one paid over $100,000 for 2 injections. Just 2 injections. Okay, we're talking about 2 injections just for the joint. Okay, they did it for more chronic issues, but you should never pay that much for this kind of therapy. So if you're looking at umbilical cord allograft for joint issues, you're looking at $39.95. So $3,995. And if we do multiple injections on the same visit, it's $2,495 per additional joint. So an example would be if you did 2 joints on one visit, you're looking at $6,490. And if you did 3 joints, so like say right knee, left knee, and a shoulder, you're looking at $8,985. So like say the average for this across the country is $10,000. If you're looking in the Des Moines Metro, currently you're looking at $7,500 to $8,000. And that's just for 1 injection. Okay, we're talking about 2 injections, 1 to the joint and 1 to the brown fat for the $39.95. And like say if you do multiple injections, as far as multiple joints, it's only $24.95 for additional injections. And our cost for umbilical cord allograft for chronic issues, like I say, typically you're looking 4 to 5 shots, and that's into the brown fat, and you're looking about $3,500 per injection. And the reason we do that is because there's more injections and the cost can get higher, we try to do it at a smaller cost. So typically that's 1 shot every month for 3 months, and then at 6 months, another shot, and then we'll see where somebody's at that point, see whether they would need another shot to get that possible 5th shot into the brown fat. So even with our reduced costs in relation to the stem cell therapy, it's still not cheap, right? I mean, I'm not dense. I understand that, you know, money is not something that grows on trees, okay? So we have options for people that might not be able to afford it up front. So we use a company called MLand, and they'll do up to 84 months terms as far as borrowing money from them. And there's no interest for the first year. So say you did $3,995 and you didn't pay off $95 at the end of the term of the loan. There is interest with that, but it would only be on the part that you didn't pay off. So say you didn't pay off $95 of that loan, the interest would only be on that $95, not reciprocal on the whole amount backtracking through it. So it's a pretty good thing, and they accept almost all patients. And the reason, like say, we want to offer that is because we want this therapy to be available to as many people as possible, okay? There's no point in making millions of dollars and helping very few people, okay? The point of this, the point of life for me, is to help as many people as possible, and this is the best way that we can do that. And this is one of the best therapies out there for a lot of these different conditions. My name is Dr. Taylor Van Weinboom. We're located in Ankeny, Iowa. Our phone number is 515-289-4549. We're at 2675 North Ankeny Boulevard, Suite 113. If you have any questions, you can also email me. My email is drtaylor, drtaylor@novaih.com. I'll get back to you within a day, maybe 2, if you have any questions with this. But I hope you've enjoyed this information. I hope it helps you see that there are a lot of things that can be done, and that you do your own research, do your own due diligence on these types of things to make sure that's something right for you. And then, like I say, if you come in, we'll go over everything together and we'll decide together if you're a good candidate for care at our office, and if so, we're going to do everything we can in our power to help you feel better. My name's Dr. Taylor, and I hope that helps.